Alright, so the drug today is ceftazidime. So I would knock. Hi, I'm Bree. I'll be your nurse today. The doctor ordered 50 milliliters of ceftazidime for your bacterial infection. Can I verify your name and date of birth?
Logan Oliver, April 30th, 2001.
Okay, so right patient. And then do you have any allergies?
No, I do not.
Okay, and are you currently on vancomycin?
I am not.
Okay, because that's a contradiction to this drug. So that's clear. And then I would check for the right drug and then right dose from the orders, 50 milliliters of the ceftazidime. And then the right route, we're doing the IV piggyback. And right time, doctor ordered it for 16:28, so it's 16:28, giving it right now. And then I would make sure to do the right documentation. And then you can dilute it with any 40 milliliters of any calcium-free infusion solution. So we have lactated ringers that we're going to do it with. And then you would want to make sure to protect it from any heat or light and that it was refrigerated 7 hours prior to administration. And I would explain to the patient that since they have this bacterial infection, which could be caused by E. coli, meningitis, or gonorrhea, that's what we're using to treat this for. It's an antibiotic. So the drop factor would be 15 GTT per minute or 25 drops per minute. And then for the infusion pump, we're going to set it at 100 milliliters per hour. Okay. So you would want to lower the primary because of gravity. Oh wait, I did that wrong. Okay. And then I would also have gloves on for this and have done hand hygiene. So then you would want to make sure this was closed. You'd want to check the tubing, make sure it was free from any damage, and then spike it. Not too much pressure, but enough to get it in there. Okay, and then you'd want to hang it, make sure it's closed. And then you're going to prime it, but make sure not to waste any solution, so you'd only open it a little bit. And you're also trying to get rid of the air bubbles. So now it's free of the air bubbles. So you'd close it, take the alcohol prep pad, and you'd want to use the proximal. Rub the hub, as they say. And you would connect the line. And then before infusing, I would do the rights again. So the right patient, right dose, right medication, right time, right route, and then the right documentation. So you would turn this on, select your channel, and then you choose secondary line, set it at the 100 milliliters per hour. And then you would open the tube all the way, and then hit start. And then you would tell the patient that some of the symptoms are painful urination or fever, and you know it's the therapeutic effect whenever the bacteria is killed and they no longer have the symptoms. And also, as far as vitals go, there's no vitals that you need to check to make sure before, because it doesn't affect blood pressure or respiratory or pulse or anything like that. And then hand hygiene, dispose of the gloves.
Hi, my name is Logan. I'm going to be your student nurse today. Can you tell me your name and date of birth, please?
Bree Luther, July 17th, 2001.
Name and birthday match with the patient's wristband. Okay, so the doctor has ordered me to give you ondansetron. It is a medicine for nausea and vomiting. Do you have any allergies?
No, I do not.
Okay, are you on apomorphine?
Nope.
Okay, apomorphine will be a contradiction with this medication. So, I'm going to go ahead and draw up my medication. So I've got my needle. I'm going to pull back 2 milliliters of air. And I'm going to flip it and I'm going to inject my ear. And as I'm drawing up my medication, I'm going to do my 6 patient rights. So I'm going to check my chart. I've got the right patient, the right medication, the right dose, the right time, the right route, and right documentation. So the doctor has ordered 4 milligrams of ondansetron. So that would be 2 milliliters, and I'm going to compare that to my bottle that I have. And I am going to make sure there's no air bubbles. And I'm going to get any air bubbles that are in there out. No air bubbles. Okay, so I've got my alcohol swab. I'm going to go ahead and do my 6 patient rights again before I administer the medication. So can you tell me your name and date of birth again, please?
Bree Luther, July 17th, 2001.
Okay, so I've got the right medication. I'm going to check for that. I've got the right medication. I've got the right route, which is IV push. I got the right dose, which is 2 milliliters. The doctor ordered 4 milligrams, which would be the 2 milliliters. And got the right medication, the ondansetron, and the right time. It is 4:53, and the doctor has ordered it for 4:53, and I have the right documentation for the medication. So I'm going to go ahead and scrub the hub of the IV tubing, and I'm going to go ahead and take my saline, and I need to push at least 3 to 5 milliliters. And what is your BP, sir?
125/85.
Okay, perfect. I would not give this to the patient if their BP was low, because it can cause hypotension. Okay, so I'm gonna go ahead and push 3 to 5. My IV tubing is unclamped. So I'm gonna go ahead and aspirate, and I see flashback. So I'm gonna go ahead and administer 3 to 5 milliliters of normal saline. Okay, I'm gonna remove this. I'm going to recap that, and normally I would have another one of these, but I don't have another one with me. Okay, for video purposes. Okay, now I have this. I'm gonna go ahead and scrub my hub again. Okay, and I'm gonna go ahead and connect this tubing. And I'm gonna go ahead and push this, all 2 milliliters. Okay, it's pushed. So before I disconnect, I would move my clamp up, and I would clamp the saline lock, and I would remove that, and I would discard this in the sharps, and I would scrub the bottle. The complications this medication could cause is hypotension and weakness. So if you have any of those symptoms, please alert us to it. This will help treat your nausea and vomiting. So a therapeutic effect of this would be the patient is no longer having nausea and vomiting symptoms. This is normally given to patients pre or post-op for the nausea and vomiting. And that is all. I'm going to remove my gloves that I had on the whole time, and I'm going to wash my hands.